Hey folks, Nick the Nurse here. Today we're going to be talking about myocardial infarction. Specifically, we're going to be talking about signs and symptoms of myocardial infarction as they relate to studying for nursing school exams and for the NCLEX exam. So let's get started. One of the big signs and symptoms that we look out for in nursing school exam questions when we're talking about myocardial infarction is chest pain. Patients who develop an MI, or a classic heart attack, they might be clutching their chest and they're going to complain of chest pain. It could radiate to the jaw or to the arms, and particularly the left arm, right? Because we know that the heart is kind of center left, and it is center left in the chest. Additionally, the patient might have the sign or symptom of elevated troponin, CKMB, LDH, and or myoglobin levels. And it depends on where we're at in the process, how far after the heart attack, and how severe it was, as to which of those cardiac markers or cardiac enzymes are going to be elevated. It's all about timing. Also, elevated white blood cell levels, white blood cell count is going to be elevated. Why? Because of the inflammation. Recall from your nursing school studies that white blood cells, the count can be elevated oftentimes, and we most closely associate it with increased infection, but oftentimes it can be elevated due to inflammation as well. Increased cholesterol levels often are seen in a patient who has an MI. Cool, clammy skin, classic signs and symptoms of a heart attack. The patient actually may be asymptomatic. Lots of people have heart attacks and don't even know it. They might have mild chest discomfort or chest pain for a long period of time, and all of a sudden they find out, maybe through an EKG randomly or having an echo or a CT scan of some sort later on, that they had an old MI. Dysrhythmias are often present with a myocardial infarction, as is nausea and vomiting, feelings of fear, anxiety, and an impending fear of doom. Patient also could be diaphoretic, and they can be pale or suffer from pallor. So lots of different signs and symptoms here. You need to know them because if you have a patient scenario that comes up on the NCLEX or on your nursing school exams, you need to know these cold. Know all of the signs and symptoms, and you'll be ready to ace your test. I want to thank you for watching my video today. I'm Nick the Nurse. You can check out any of my other videos at www.nickthenurse.com. They are completely free, no obligation. Check them out, nickthenurse.com. Again, thanks for watching. We'll see you next time.